Okay. Hello, All-Star clients, and welcome to a Christmas-themed episode of Veterinary Roundtable presented by All-Star Veterinary Clinic. We hope each and every one of you have a wonderful Christmas tomorrow morning filled with fun and joy. For our new listeners, let's break down the format of the Veterinary Roundtable.
First, we will run through housekeeping, which is essentially updates about the podcast, our content, and anything we think should be on your radar. Second, we'll break the ice with a few icebreakers. Regardless of how well we know the guests on each episode. Third, we'll jump right into case collections, where each of us will share an interesting case we've recently encountered. And lastly, client questions, where we'll try our hardest to answer a question or concern from one of our clients. So before we introduce our guests, and let's go over some quick housekeeping things.
Yes, this is very exciting.
Go for it.
All-Star is having or had babies. We released a video this week surprising our staff with 2 new clinic cats. The names are still pending. Dun, dun, dun. This wouldn't have been possible without the lovely ladies from the cat rescue at Petco. We appreciate all of you.
They are called Paws on My Heart. I know, right? It's just so sweet. And the ladies there are just so nice.
They were so just happy about the pets going to a home. And
yep.
If you guys stop by, they're in pharmacy right now because they're too small. They can't run around the clinic. We'll lose them.
That's their home base.
It's a home base for
their
now.
collars yet with their bells.
Yeah. They're too small.
Yep. One has cerebellar hypoplasia.
We should talk about that.
Why don't you talk about that? Duck walk.
Well, the mom had really bad mastitis, which is infection in the mammary glands. And so we think, supposedly, the infection got passed along when they were nursing. And so it affected the development of the cerebellum, which is part of the brain. And
that's responsible for?
Some motor.
Balance. Yes, ma'am. Good job.
So now if you see him, he walks like with a cute little gait. It's like he's prancing his like high steps in the front. And then it's kind of like, he's like, whoa. Did you? Yeah,
he's very cute.
But it's mild. So he's still jumping and sure-footed. He's cute.
We laughed. 2 veterinarians pick out the sick animal.
Yeah, like, was this on purpose?
No, like totally not on purpose at all. Like
literally, as we signed the papers, like just so you know,
by the
it
way,
has this. I'm right.
Oh, they were keeping it from you?
No. I don't. No. They weren't doing that. It was like it.
It happened so fast. It was like a mad rush. I felt like it was like Black Friday for
yes,
cats. And we were like, we want these. Go tell her really quick.
Yes.
These are ours. These are ours.
Because people just kept coming in, like to buy, or whatever, adopt other pets, and I was like, I felt like somebody was gonna just snatch them out from under us.
I know.
You got the best ones.
Yeah, we did. They're awesome.
Oh, they're so cute. Anyway,
so
wait, you missed a paragraph.
I missed a paragraph.
Yes.
Okay, so if you haven't sent us a question for the podcast, please do so. We want all of your questions. Feel free to message us, comment on our announcement video, or email Harrison at all-starvet.com. Speaking of, shout out to Chris Williams for a tough.
That was tough. It got dark and deep. Not dark, it just got deep.
Yeah. But fantastic question regarding preventives last week.
Yeah. If you haven't listened to it, listen to it because it addressed some really good questions. It just was like more intense.
Yeah.
I like to have fun on here. I don't like to be intense.
Now let's get to our guests. My co-host, Dr. Ashlyn Duckwall.
Thank you.
Oh, okay. Good job. We have Elise Augustine, who is a veterinary technician here at All-Star.
Oh, snap.
Yeah, she's amazing. Yes,
I
absolutely.
only snap with one hand.
Elise, how are you doing today?
Pretty good.
Are you excited to be here on the
I
podcast? You look like it. Great. And then we have the most amazing.
Woo!
Bring out the thunder. Dr. Allison Faust.
The one and only.
The one and only.
The one and only. That's right.
Yep.
Any and all questions about cats,
Yes,
send them your way. She can also do dogs, but
Yes, I can. I can do both.
she can do both.
We
Don't
see
be
dogs.
fooled.
Don't be
see
fooled.
dogs.
That's right. But we like to fill her calendar with cats.
That's right.
Yes, they do.
So,
Yes, they do.
and
How do you
which
feel
means
about that,
Elise, because Elise is you are her technician. So then, therefore,
Yeah.
you
I
by
also
de facto
see
see
cats.
cats.
Yes. I see a lot of cats.
That's a lot of
I see a
cats.
lot of
How does that
cats.
make you feel?
I can't have cats at home because my dog. So I get my cat fill here.
There you go.
There you go.
It
Okay, that
balances
works.
out. Balances out.
That's nice.
Excellent. That's a good way to think about it.
Yeah, that's how I think about it.
When that cat is ready to eat you. Okay.
Happens quite often.
So, Icebreakers.
Mm.
All right, guys. Duckwall, you're first.
Okay.
Which one of your coworkers is the likeliest to wait until the last minute to finish Christmas shopping?
Jones.
Totally.
Yes. That's exactly who.
Oh,
100,000%.
Who would you? Yeah, I
kinda
agree. Oh,
forgot
wow.
about Jones, 'cause
I
of
just-
that.
I
Yeah,
didn't-
she's having a baby.
That was like so quick. That was just like,
I didn't
boom.
even read this question prior to this podcast. So as soon as I was reading it, it's like a no-brainer.
That is amazing.
But we love Jones. Oh my gosh, I miss her so much.
I do too.
She's resting.
She'll be back in a little bit.
Yeah, she'll be back soon. But
I think
God
she's
love her.
enjoying her time away from us.
Yeah, she's got a cute baby. Did you see her?
God,
Blame
he's
her.
cute.
So
He's
cute.
cute.
Yeah.
What about you, Elise?
I actually thought Duckwall.
Oh. Actually, you'd be happy to know I finished all my Christmas shopping.
Did you
It is
really?
the earliest that I've ever done it, though. So
Wow.
she's
That's
not
pretty-
wrong. She's
very
not wrong.
good.
I
very
feel like
good.
this year, like I don't know what to get anybody,
Yeah.
and I just like go into stores and I'm like, that sounds good, and then later I'm like, why did I buy that? Why did I buy that? So I haven't
Well,
finished mine.
Amazon. That's all I gotta say. It takes over the universe. And
Oh, wow.
straight
I
to your
agree.
door. It's perfect.
True.
What about you, Fausti? Who would you say?
Jonesy first, Dudley second, just because I imagine them both in a whirlwind with their babies and
Yeah. Yeah.
I would say Becca Fidel.
Yeah.
Yes.
That's a good one too.
Oh, I thought we were. What was the question? I thought it was just the doctors. What?
No,
I read it wrong.
Who's the last person? Who would wait? Which one of our coworkers would be the?
Got it. Okay.
But so Becca Fidel would be my pick from the first podcast.
Yes, she was in
Right?
the first podcast.
Yeah.
Yep.
Yeah.
Yeah.
I bet if I ask her tomorrow, she doesn't have it done.
We
Ooh.
need to ask her.
You should ask her.
Yeah, totally.
Okay. Number 2. What is your holiday guilty pleasure? Faust.
Shoot! I was hoping everybody else would go through it. I even asked Tommy this morning. I was just like, "Do you know the answer to this question?"
Okay, I will go first. I will say rum chata and fireball.
So, like, is it limited to drinks?
No,
No.
it's whatever you
Speaking
want.
of, yes, your
Some things
husband
are not to be
taught me
mentioned,
about
but yes.
this new combo, and it is a delight.
Yeah.
Rum chata and fireball?
Yes.
It is, isn't it?
Because I hate Fireball. I would never drink that by itself. I got sick of rum chata when Tommy bought me the biggest thing you've ever seen. I got sick of it. And then Richie just mixed the two together, and I'm like, that's a delight.
What's
It's
it
really
taste
nice.
like? I
And you
didn't
can
try
put,
it.
like, some people will make it with, like, also vodka that has, like, either vanilla vodka or something. I don't know. And it's supposed to taste like cinnamon toast crunch, basically.
And then he said, like, put nutmeg or something
Yes.
on top. Like, that would probably be tasty.
Yeah.
Fireball and Angry Orchard is good together
Yes.
Oh, I haven't had
Yes.
that.
Angry Balls.
Angry
is what
Balls.
it's called.
Okay.
Balls.
too. Angry Balls.
That's the name. We
What's
didn't
your
make it
guilty pleasure, Elise?
All that candy in the kitchen.
up. Oh gosh.
Candy,
yes.
the cookies. Every time I walk by, I'm like, you don't need any, you don't need any, you don't need any, and then I get some.
Yeah. Yeah. That's a good one.
We're so lucky. Our clients like
They're so good.
bring stuff in for the
Yes.
holidays, and it's amazing.
They're good to us.
Somebody brought fruit in, and I was like, oh, thank fruit. I need some fruit.
Yeah, or just like a quick sugar rush. You just walk by the kitchen and have a piece of candy, and you're like, "All right, I'm ready to go for like an hour."
Yep.
And then
then
gotta
you
go
crash.
again.
And then you crash.
Yeah, I'd have to say a high electric bill because I,
What? For your guilty pleasure?
I'm going to explain it. I keep all of our Christmas lights on, even when it's bright, like daylight out. I'm plugging those things in our house. I'm burning candles, which isn't electric, but I'm just like all the feels in
Of
my
Christmas.
home. So now
I would say
when
my
it's-
house is like that too. Yeah.
Yeah. And when it's not Christmas, I turn lights off because I don't usually need it if it's during the day or I'm like not in a room. If I'm not in the room, the lights are still on because
Yep.
it's just happy.
It is.
So that's my guilty pleasure.
Do you have one? Did you think of one?
She's going. Are you going with the rum chata?
Oh, I thought I was done. Yeah, I just dittoed.
Okay,
yours.
ditto. That works.
It's a good ditto.
Okay, what holiday thing do you wish would last all year long? Duckwall.
I need a minute, Elise.
Ice skating.
Oh.
I love ice skating. But like, don't we have the technology to like go ice skating when it's like 70 degrees outside? Like, I want to.
Probably.
Oh, and like where it would be outside?
Yeah, like I want to
Yeah.
outside and I want to go ice skating all the time. I love ice skating.
Somebody out there is holding out on us. They
Yeah.
have the secret. They just haven't shared it.
Yeah, and I want it. I want that secret.
Or you could create it and be a billionaire.
That's true. That is true.
I'm gonna go with Hallmark Christmas movies. Oh, which by the way are out all year round now. I think probably.
Yeah. I thought that was Richie's thing.
It is now. Richie's got me addicted to it too.
Yeah.
So
They're all addicting.
I mean, we just watch them
You
and we
watch
laugh.
it for
We
5
try and
minutes
predict.
you're like, oh, it's so dumb. I can't.
You're laughing at the
That's exactly how it
cheesiness.
is. We
Yeah,
laugh. We always
terrible.
like try and predict what's going to happen. We're like, all right, her sister's going to quit her job, move to so and so, do this, get hooked up with the brother of the so and so. Okay, let's watch and see what happens. Yeah, it's funny.
Yeah, that's a good one.
Faust.
I would piggyback duckies with the lights.
Mm-hmm.
I leave them up now all year long. Not my Christmas tree, but in the living room, the 2 whatever decorative trees, I keep the white lights up all year.
Nice.
Actually, I did that last year. I had like not a Christmas tree, but just a tree, and I kept the white lights on it.
Mm-hmm.
That's the
Isn't there
Italian
some like
theme.
there's some like I don't know what you call it, some folk thing where like you're supposed to keep something out of Christmas, like for good luck for the next year or something. Have you guys ever heard that?
No idea.
I don't know.
I totally pulled that out of my ass. I'll look that up and
Okay.
let us know if that's true or not.
Add to the list of things to do after the podcast.
I know. What are
'Cause
we at so
always
far?
accumulate.
Chicken Alfredo.
Chicken
What was the other thing from last week? I was supposed to bring with the chicken Alfredo.
I know, because we kept adding to
know.
it, and we
I
talked
know,
about
right? We need the
not-
list so
not
that can
cake
be.
cookies. We've had
We need the list of that, Harrison.
Wasn't
Then we
soup?
can.
Didn't
Yeah.
somebody talk about soup or something? I remember. I'm hungry.
probably we
I'm
talk about
hungry,
food
too.
and we make a meal,
Yeah.
but then it's a really weird meal.
Yeah.
We're gonna have to go back through and listen to everything.
I know. We're
and
gonna
make
have
a
to
list.
listen to it, and then we can bring all that stuff in.
Yes.
Okay.
Okay.
Answer all those.
And then people
questions.
can just watch us eat and listen.
Well,
to us
the
eat.
problem is we do this at the end of the day, so then
know.
we're all starving.
Yes. So we could spend the whole time talking about food.
I totally
Yeah.
could do that.
I
Yeah.
could do
Fun.
that. I love food.
Yeah.
We do love food here.
I love food.
Yep.
That's just.
I love talking about food when you're eating food too. So like, what's going to be my next meal while you're eating
The current meal.
Yeah, because you got to be prepared.
Yeah.
You know what? That's so hilarious because we would laugh all the time at my grandparents who would always be planning their next meal while they were eating their existing meal. And I was like, oh
Look
my
at us
God,
do
for the
it
love of
now.
God.
Yeah.
I'm like,
Yeah.
can you just finish this meal before you figure out what the next meal is going to be?
Yeah. Stop and smell the roses.
Yeah. They
That's
could
the
not.
only thing that needs to be planned on vacation. What's the next meal?
Yes. Yep. That's
I am not good at planning meals on vacation. I would rather just like live by the seat of my pants.
Oh my
Like,
gosh, I yelp it all day long. Where are we going to eat lunch? Where are we going to eat dinner? While we're at dinner, where are we going to eat breakfast?
I want someone else to
today?
bring it to me. I'm just going to do nothing, but I would like the food to show up. That would be great.
Yeah. Yeah.
No, I'm with her. I like to know, and I like to look at the menu
Yes,
beforehand
think
because I
about
want to
it.
know. Like, do I want this? Do I want this? I like to.
You want to know.
I want to know.
I'm with you. I'd like something just to be brought to me, or like literally walking up from the beach to the hotel, just like have something there.
Yeah,
I don't
like
really
here's your
care.
food.
Yeah.
I want that when I'm home, not on vacation. I just want the food to be brought to me.
Oh, true.
So
True.
yeah.
I'm really lucky because Richie just makes the food.
You
And
should.
I make the food on the weekends, but during the week he makes the food. So like tonight he's like, I'm making Hoosier ribeyes,
Oh my god.
white rice, and something else. And so I'm like, oh my God. I
Oh,
can't wait
that's so nice.
I know he's so nice that way.
I get home at like 8 p.m. and I'm like, what are we eating? Charles like, I don't know. It's like, I ate a salad last night for dinner at 10 p.m. I wish I could make this stuff up.
Salad hits differently at 10 p.m. You're like, ooh.
I felt a little queasy afterwards because I was like, I just ate a really big salad full of Caesar dressing.
Oh my
And then I
God,
go
that's
to bed.
hilarious. All the men in my family like to cook. Johnny cooked. I came home last night after that blood transfusion, and Johnny had whipped up homemade chicken nuggets in the fryer, in the deep fryer. He's a good cook. I'm like, I went upstairs and I was like, can I have some of those chicken nuggets downstairs? He's like, oh yeah, there's plenty of them. So I tasted. And I was like, Johnny, these are like restaurant. These are like good.
Okay, I'll start paying him to do food prep meals for me.
Oh my gosh, I was like, these are
Yes.
fantastic.
Drop them off at my house. Tonight
Don't
we're
you have to go
having
to war to
chicken.
figure out who's making dinner at your house?
Don't I have to do what?
Go to war.
like a Nerf war, isn't that?
Oh well, sometimes.
Sometimes it
I
calls
walk
for.
in and the Nerf guns are there, and it said the loser makes dinner. Well, I always make dinner. So I'm like, okay, the game's on, but I still have to make dinner.
Oh, gosh. All right. So let's move on to case collections.
Yes.
Elise, do you want to go first?
Sure. I tried so
you have
hard
a humdinger.
to think about a cat, but all I could think about was Sadie Ward, who came in. She was kind of lethargic, and we thought, oh, maybe she ate something. So we did x-rays thinking maybe she has a foreign body. No, she has a stone in her kidney the size of Texas.
So was she?
So big.
She's like she was an older Cocker
She's
Spaniel.
young.
Yeah.
She's a
she's
younger
Is she the
Cavalier.
3-year-old? Oh,
She's
the
the
Cavaliers.
3-year-old.
I'm
Yeah,
thinking his
yeah.
other dog was the Spaniel.
Yeah, she's like
that's
3,
right.
3-year-old Cavalier. So we sent her to Purdue thinking they would do surgery to remove it. Turns out she doesn't have another kidney. She has one kidney with one stone.
Crazy.
And a uterine mass. And what
She has,
else did they
she has a
find?
splenic mass and a
Splenic
hernia.
mass.
And she, I think, has luxating patellas.
Probably, yeah.
Oh, she's
I don't know
She's
if I
like
was supposed to say
super
her name,
young,
but I think
isn't
I-
she?
She's
Yeah,
really
we do.
young.
Yeah, she's like what? Isn't
But
she
had like
3 or
no
4?
symptoms other than just slightly off.
Yeah,
just like
an ADR.
Yeah.
the whole kidney was a stone.
It's amazing.
I remember you seeing those x-rays and you were like, oh my gosh, you need to come back here now.
I did the
Yeah.
x-rays and I was like,
That
we
doesn't-
should call Faust right
There's
now. I
something
did
wrong.
one lateral and I was
There's
like,
something wrong.
that's not right. I was like, is that a baseball? Does she eat a baseball?
Yeah.
And I was like, that's her kidney.
It
It's
was
not
huge.
right.
That's one
That-
you're sharing with all your friends,
Yes.
family. You're like, look at this thing;
Yes.
it's huge.
Yeah, I mean it was. I don't think I've ever seen one that large.
Uh-uh.
But then when we went and did a literature, I mean, I think we found there have been other cases.
Yeah. It
Reported
has to do with
where-
her not being spayed and it was an infection.
Yeah,
I can't
think
remember.
so.
It was like the combo.
Of
And
the
she had
two.
stones.
Because like once the infection is cleared, the stone goes down, like then she has to be spayed so it doesn't come back. Like if I remember right.
When's the last time she was checked? Like, what's the progress on the stone?
The last time she was in was August. So we did antibiotics and food.
She's been on antibiotics now for over a year.
Yeah. And every time she comes in, we do x-rays, it gets smaller.
Yeah.
Oh, it is. So it
Oh, yeah,
is getting
yeah,
smaller.
Yeah.
So
It's like
So fascinating.
oh my gosh, half the size now.
Yeah, yeah.
It's really significantly better.
Yeah.
so weird. And so she's on a dissolving diet.
Yep.
Mm-hmm.
Yep.
Why don't you explain that? Do you?
So the diet changes the pH levels. Well, I guess I know how it works with urinary stones. It changes the pH levels to dissolve the stone. So I guess it works similar to that with kidneys since it has to go through the urine and everything like that. So it changes the pH level to dissolve the stone. So it's just going to eat away at the stone.
slowly over
Since she
time.
wasn't a good anesthetic candidate because she had one kidney to go under and remove it. So,
Yeah.
and Purdue was like, we don't know if this is going to work or not. Like, we have no idea. And it's working.
And her kidney function's good. She's
Yeah.
that's crazy.
Yeah.
She's due for a recheck, so I don't know where things are at now because it's been a little while.
I
but-
think there's a callback in to recheck it sometime
Yeah.
soon because we were doing every month to recheck the x-rays. And then it was doing so well, we decided to do every 3 months and
Right.
things like that. So,
So then it must be a struvite stone then.
Yeah.
Is that what we're assuming? Yeah, based on the. That's so cool. That's the one type of stone that can dissolve. So
and she had stones in her bladder too. She had the big stone in her kidney and little stones in her bladder. So they're all going away.
that's amazing.
Isn't it amazing how they can have one kidney this whole time and still with this issue and still have normal functioning kidneys on blood work? Like, I know you have to lose 75%, but like still,
But like that stone was taken up 75%. I was like, what?
Right.
What part is functioning? But
Right.
It was
Yeah.
doing okay. I don't know. Really weird.
Fascinating.
animals are fascinating.
And she comes in, she's so happy. I love to see her every time.
And he loves her. I
Yes,
mean, he's a very
yes.
passionate person about.
Yes, they both love her. She's very well loved.
Yeah.
Yes.
That's all you can ask for.
All right. What about you? Oh, me.
Are we-
I
we're
guess
sharing
I'm doing,
it.
We're sharing it.
Which one are we doing?
We've tossed around a couple ideas.
Which one do you want to do?
So I think we talk about the. Did we say which one we were going to talk about? Did we ever decide?
I think it was like back and forth between the neurologic dog and the IMHA dog.
Yes.
Yes.
So let's talk about the neuro dog.
And the other kidney cat. But we talked about kidneys. So we can do the neuro dog.
Okay. So
But
the
that's
neuro-
all you.
So the neuro dog was a 7-month-old sheepadoodle.
Yep.
Right, 7-month-old sheepadoodle that came in. Actually, it was about. I was seeing it like a third presentation. So it had been to 2 veterinarians, and it had been out playing, and it was limping initially on the right front leg. So they took it in and they treated it for, maybe right front leg discomfort or pain or whatever, and put it on an anti-inflammatory. Wasn't getting any better. And so they took it into VCA Advanced Specialty Care. And at that time, the dog was still just it was still acting normal, and it was just the right front leg. So they just, added additional medication to the current medication as far as like quantity. And then I saw it because it couldn't go back to its original veterinarian. It couldn't get into its original veterinarian. And so it was at that time then ataxic in the rear, was able to stand up and move from
What
one
is
end.
ataxia?
Oh, thank you. Nice.
For all those listeners.
Like fishtail, drunken soul, like, whatever.
Yeah.
I don't know. Is that
That's better than
Drunken
words.
stagger.
Thank you.
Stagger.
Okay. And so he was like that in the back end, but he was still able to use his front legs. I could isolate pain on flexion of his neck. And so we treated him so we started treating him for pain. The next day we came in, he was no longer able to use his front legs. So he could not use them at all, pretty much, right? At least,
Yeah,
he had deep pain in all 4 legs, but now
What is deep pain?
Who is this person? Deep pain is where you could, we assess for it by pinching their toes to see if they can actually feel it, the pain in their toes.
Just wondering.
In their
and he
legs.
could lift his
And their
head,
extremities.
but he just couldn't walk. He couldn't.
Right.
He couldn't set himself. I felt like if you held him up, he would just want to fall over.
Yeah. So if we stood him up, then he was not able to bear weight. He didn't know where his feet were in space. And so then we tested him for a bunch of different differentials for all 4 legs being affected, because then that's how we would isolate the lesion that would be in the neck or above. So then we submitted titers for infectious diseases, and so we tested him for that, and then addressed pain, and was working with the neurologist locally, and he was not improving. So after 3 days of hospitalization, he just was not getting to where we thought he should be based on our treatment. So then we turfed him so we could get advanced imaging, and Dr. Cross found that he had lytic lesions in his spine and his dorsal nerve roots, so in his neck, in his cervical area, and so then he diagnosed him with lymphoma. And so unfortunately he was euthanized. But I've never in this many years ever seen a dog
7
that young.
months old.
Yeah. With lymphoma of his spine.
And he spiked a fever day 2 that he was here. We took vitals on him, and I was like, oh, he has a 104 fever.
Yeah. Which he was 102 for most of his stay, and then he spiked up to 104. And we couldn't get that under control. And that was then our clue. Then we sent him after that. He needed additional testing, which we can't do here. So,
Yeah.
But the couple was so sweet and so nice. I just wanted to save their dog from they were older.
Just dealt a bad hand.
Yeah.
There's no stopping that.
There was no stopping that. But it was interesting because it progressed over about 3 weeks. The timeline was 3 weeks, from when he presented to death. So, very sad, but very, very interesting case.
Yeah. And it shows medicine only can go so far when you have something that's that severe, and you're just tried I remember we talked about it. You tried everything under the sun to figure out diagnosis, treatment, and it just
wasn't in the cards.
Nope.
So his name was Ringo. He was a good dog too. He was easy to work on.
That's good.
He was a pleasant dog to be around.
He was a good dog.
Rest in peace, Ringo.
He's running up there now.
Oh gosh, exactly. Okay, so is that it for our cases? I think so. Are you going to talk about one?
Oh, that cool cat that had the string.
Oh yeah,
Yeah.
Talk about that.
I can't remember if that was. Yeah, that was that mine?
I think so.
It was mine that I passed to you
Yeah.
for surgery. Okay. It's been a while on that one. But so cats like to eat string, and the x-rays showed that pattern. However, no string to be found under the tongue, and then you took it to surgery, and it had cut through
and kind of that tissue was kind of laying over the top of it.
Oh, wasn't it clear too?
So yeah, and it was clear. It's like
yeah.
dental floss kind of thickness. It was really thin.
It's just crazy.
Not yarn.
I
but
remember that now
thread.
because you tugged to see because it wasn't coming loose. And I think, weren't you in the stomach and you were like trying to figure out where's this going? And all of a sudden,
Yeah,
like,
because I
it's
could not.
lodged somewhere.
Right. Yeah.
And then someone found under the tongue and
Yeah, because it was
released it.
it was just buried under there. That's what we're taught to check for all the time, you know, because
Which we do. But
Oh,
it's
yeah.
like you can't see that.
No.
I mean,
and I think that's the first time we were like, well, even though we
crazy.
can look, it doesn't mean necessarily it's not there unless you can just
well, especially think of like animals in general. They don't want you moving their tongue,
Right.
pulling it out, like, and you need a solid like multiple seconds to really get a good look. And
it was hard to find even once
Yeah.
we figured out that that's what we were pulling on. Like they were looking at the other end, like in the cats. I think somebody was like, I don't see anything. And I was like, there has to be something.
yeah,
And then we found it.
because they had already looked, I think, like before when they were doing intubation,
Right.
and then you made them go back because you were like, it has to be somewhere.
Right.
So,
And I think I remember the owners, like, after we said that, they're like, yeah, he likes to get in the bathroom trash. Because I think it was dental floss.
how interesting.
Yeah.
so
They
interesting.
get
I've never
themselves
had
into so
that.
much trouble.
I've never had that one.
Yeah.
Very fascinating. Okay.
Yeah.
On to client questions.
Yes.
Faust, this is a great question for you. Why do cats scratch and get sores around their mouths? What would be causing this and how to prevent it? What are your recommendations for cat toothpaste / oral care? Thank you.
Okay.
At Chelsea, how would you say that, Harrison? I'm not an English person. I'm not good at this. Aurori?
I don't know, but thank you for saying thank you.
Thank you.
Wow.
Yeah.
So sweet.
So what do you think?
Well, cats scratch their face for a lot of reasons. So I think you got to break it down depending on how their skin looks. Are they going towards their face versus ears and neck? She's asking about lesions.
Yeah,
in
because it
the-
says sores around their mouths.
Yeah, so sores around the mouths typically are going to be like your rodent ulcers that are allergy related. And those allergies can be environmental, food hypersensitivity, bug bite hypersensitivity. And I do see a lot that are allergic to plastics with that one. So we typically get rid of their food and water dishes that are plastic and do like metal or glass. Make sure they're on monthly prevention. Sometimes we'll change the diet to a hypoallergenic version and just kind of go down the list of allergy stuff. But if there's no lesions around the mouth and they're itchy on the face, we want to rule out like ringworm and just the other basic infectious things too. That we don't. Sometimes like there's mange mites under the skin. It doesn't have to be just facial itchiness, but so yeah.
I don't know if you necessarily can say how to prevent it per se, because like unless it was just related to the food bowls, like, do you know what I mean? Well, then we could say, okay, so do you tell everybody never use plastic food bowls, like just to start with? Like, is that just like a rule of thumb?
Not necessarily.
Right? Yeah.
Yeah, I mean,
I think it's just
No.
kind of luck of the draw.
right.
If you get somebody with, you know, like meaning a cat, if you adopt a cat or your cat ends up developing those types of lesions, if they're associated with allergies, there's things you can do to make it easier probably and to treat them to make them more comfortable, but potentially like ever preventing it from occurring. I don't know if you can necessarily,
know.
there's something you can do from the get-go.
I guess you could be like overly cautious because I'm just thinking I had a patient that was a cat and the owner, it got a rodent ulcer and it kind of popped up out of nowhere. But then going through history, found out she had just like mopped and cleaned her floor in her kitchen. I don't remember what the cleaning solution was, but that cat was just kind of adventurous and had just sniffed around there. And we don't know if it got into the actual cleaner, but I guess if you really want to just be like, I don't want my cats around I'm cleaning, that's another way, or using cleaning supplies if they were sensitive to it.
I think sometimes too, you just never figure out what it is. You know,
I feel like that's the case all the time.
You have cats that rub their face on so many things in your house, and so much you don't even know what they're rubbing on. You know,
and why do they rub their faces on everything?
Oh, what do they love to leave the little facial pheromones? They're happy. Other times, they're it's like if they have dental disease or they're painful. Like I see those kiddos rub their face more aggressively sometimes with. Corners of furniture, things like that, and it's an oral issue because they're uncomfortable. They're not itchy per se.
That's what I was going to say is depending on the age of the cat and their dental health in general, like they can get pretty sensitive.
Yeah.
So
we even had that cat that was chewing on things because its dental disease was so.
Yep.
So it just chewed on things just to
that's how
make itself feel better, like basically just...
that's how the owner knew it was like chewing on everything in the house. And we looked at its teeth and...
Yep.
Wow.
We had a dog do that recently too. The owner was like, it randomly started to chew the wood, like just wood anywhere in the house, like baseboards, wood furniture. And so I'm like, well, let's check the mouth first. And sure enough, the tooth was fractured. So I don't know when it had fractured it with when it started to chew, but we'll see that sometimes where it's just a weird behavioral thing and it's a source of pain.
You know what's so weird with dentistry is one of the common things I hear from owners is that like you fix their dental problems or their issues or the infection and the inflammation, and then they'll come back for rechecks or whatever, and they're always like, I never realized how uncomfortable they were. Now they're doing this, or they're carrying this around, or they haven't done that in so long. I thought it was just because they were getting older. You know, and it seems like
all the behavioral stuff that can subside when their chronic pain is gone.
Yeah, it's crazy. It's fascinating.
And like, especially too, because animals hide things so well, especially cats, that there can be a lot more underneath the gums that we can't even see, So that's why doing like the routine cleanings when tartar does build up is helpful, because you just, until you get those x-rays done and see what really, how severe it is, you really don't know. You can have an idea. But
I've been so fooled before, though, where it's like you've got, one tooth that has so much buildup and you get them under anesthesia and your probe goes through the tooth next to it that has zero tartar and looks perfect. And it literally went through it. It's like, okay.
Yeah. I thought it was going to be this.
Guess we have more than one extraction. So,
yep.
It's crazy.
Well, on that note, what are your recommendations for cat toothpaste and oral care?
Cats are fussy, so if you start them early or they like really love food and flavors, you can, start like offering toothpaste off your finger for them to just lick it off like a treat. I do like the CET brand you can get online. They have a bunch of different flavors, so starting with like a poultry flavor or something like that. But some cats that you can't get past there, like at least the toothpaste is working on contact and it's doing something, but ideally you want to scrub a little with some sort of brushing. So I like to do either like a little 4x4 gauze pad, like you can get gauze anywhere at CVS or Walgreens, and just wrap one little layer around your finger. So once they're used to like licking it off, you can kind of do like a light scrubbing versus just your skin that's not really going to like scrub the teeth. Some people will use like a washcloth. I find that they can be bulky unless it's just like a little baby type washcloth or something like that you can really do a thin layer around your finger. So yeah, as far as
what
like,
you're saying is it is possible to brush your cat's teeth.
It is for sure. For sure.
Good
I
to
mean,
hear.
especially since like those ones that really love to rub their face, love chinny rubs. If you come up from behind and you're just loving on them, and the next thing you know, whoop, whoop, we're just whoop. Nothing's happening, darling. We're just getting in there and doing a little something. So yeah.
Yeah. That's good. I really like referring my clients to the Veterinary Oral Health Council dental chart. So if you just type it in, it's VOHC products for cats. In this instance, they also have one for dogs. It lays it out beautifully. They have it under treats, under food, water additives. You know, if there is just a spicy cat that just won't tolerate any type of contact in there, there's other avenues too to at least do something for oral care as opposed to just doing nothing and letting it go. So
And there are spicy cats out there.
There are some spicy cats.
I haven't had too much success with cats and the water additives because I feel like it's so important for them to be good drinkers. And they're so fussy. Like even the brands that, you know, you've got tablet form that dissolves, like Alka-Seltzer is supposed to be like odorless and flavorless. Like they can tell.
They can
just tell. And
you don't want to deter them from the water.
Yeah. So I would rather, you know, if an owner can either wipe with nothing or they lick the toothpaste, you know, like you can just rub a little bit on their forearm and they just lick it off. Like it's doing something. I haven't had good luck with the wipes. There's such a strong clove flavor and scent. I think it's a little repulsive to cats, whereas dogs want to eat them. So.
They do.
We've had that happen before.
Yes, we have. Yeah,
like the greenies treats, and do a good job.
we have some dental trees here for cats, right?
Yeah, we have the tartar
Tartar
shield.
Shield.
And they're in the. I talked with them. I think it was last year at the VMX conference, and they're in the process of getting the oral health seal on the kitty dental treats.
That's cool.
But it costs like $40,000+, and so they're like it just takes time. And so they're in the process. The research is good, but it just does not have the oral health seal yet, like the greenies do. So, so I was glad to hear that because some of their other products they're not even going for the oral health seal, and it's just
Yeah.
you know, I'd rather do
Why? Explain to everybody why that's important.
because the research has been done. They've paid the money to have good backing of that product. And so, you know, like in the product lines, if you have a company that has some with the oral health seal and some without, I'm still going to want to go for the ones that have that seal on there. Even though like, I get it. I didn't realize there was such a financial
Strain
commitment.
or commitment.
Yeah. With that, I thought it was just, you know, get some research done and call it good. But so anyway.
Yeah.
Well, and that seal basically means that whatever they claim that they do, it does. Right? I mean, so I think that's...
Yeah, because there's so many products. You go to the pet shop, it's like overwhelming.
Reduce
and
plaque
it's
by
just
30%. It's like,
nothing
does
has
it?
any backing behind it. And, you know, people are just totally overwhelmed with what do you get, what works, what doesn't. And so like you said, Ducky, I like that website to refer them to.
And
So
the
helpful.
products have that like little stamp on them with the veterinary oral
Yeah.
products on them. And then they're usually like pretty big.
It's
You can
pretty
see
big,
it.
yeah.
Yeah. It's good
Very
stuff.
cool. Good stuff.
We like when we have good resources.
Well, guys, that was great information.
Yeah.
I really appreciate it.
We kind of got on a tangent about dental care, but basically there's
I know,
a lot
we
of
should have
reasons.
Cloud on here.
I know, right? We should just like peek through the door. You know?
But basically, there's a lot of reasons why cats can be rubbing at their face, their mouth. And so it could be skin, it could be allergies, it could be teeth. So let us look. And
I was going to say, yeah, if there's lesions or if you're questioning whether or not the rubbing is normal, then I'd say have a veterinarian look at them to know whether or not.
Videos are so helpful.
videos,
and
yeah.
for anything.
Pictures, videos.
Yep.
Yeah, absolutely.
Well,
All right.
did it again.
We did it again.
wow. Look at us.
Okay.
Time for dinner.
Time for dinner. I hear that
Time for a
dinner bell.
salad.
I hear that dinner bell ringing.
No
I'm gonna have a
salad.
salad.
No salads tonight. I'm going home and get some steak.
I'm coming to your house.
Steak. Gosh. All right. Well, you guys, thanks for joining us this
Thank you.
episode. Really
Thanks
appreciate
for
it.
having us.
And thanks everybody else for turning in. I don't know.
Turning in. That works.
Turning in.
Just keep going like you know what you're doing.
Tuning in to another episode of the Veterinary Roundtable.
Okay. I don't have this memorized like you. Hang on. Remember, send in those questions and be sure to follow us on all social media platforms at All Star Veterinary Clinic. If you enjoyed this episode or a previous episode, leave us a review on our podcast provider of choice. We'll see you in a few weeks for episode 4.
Well,
I thought this was 4. Harrison was
Harrison
right.
Brands, it's 5.
I
He was
knew
trying to
it.
trick us.
Knew it. Wow.
Yeah.
That's it.
That's it. That's all we got for this week.